day of surgery. The day of surgery has arrived. Now we'll go over the steps to follow before you head to your surgery location and what to expect.
On the day of your surgery, you will want to be sure to adhere to the following guidelines. After midnight, you may only drink water, Gatorade, black coffee, or plain tea up to 2 hours prior to your arrival. Once you are within 2 hours of your surgery time, do not eat or drink anything. Note, the use of cream in your coffee, tea, or consumption of any other food after midnight will result in either the delay or cancellation of your surgery. Take a full bath or shower, washing with the Hibiclens as instructed on the morning of your surgery. Wear comfortable closed-toe shoes along with loose casual clothing that is easy to remove and put back on. This will make it easier for you after surgery. Open-toed shoes can be a full hazard after surgery. If you wear eyeglasses, contact lenses, hearing aids, or dentures, bring these items along with their storage cases and any supplies you'll need. As a precaution, you should bring any important legal forms, like a living will or a durable power of attorney. If you would like more information on preparing advanced directives, the pre-admission testing team can assist you. Remember to bring your photo identification, driver's license, insurance cards, and co-payment with you for registration. Any items brought with you should be given to your partner in care for safekeeping. Plan to arrive at the facility 2 hours before surgery. St. Elizabeth has multiple surgery site locations. Before leaving, you should verify the location and address of your surgery to ensure you are traveling to the correct location. Maps and address information can be found at www.stelizabeth.com. Regardless of where you have your surgery, you should enter via the main entrance. An associate at the entrance desk will be happy to provide guidance on where to go from there. Do not wear any perfume, makeup, deodorant, lotion, baby powder, or jewelry to the facility. Note, if you are unable to remove your ring, please see a jeweler beforehand to assist you with removal. Do not have any finger or toenail polish on and no acrylic nails. What to expect after you arrive. Upon arrival, you will be taken to the same-day surgery preoperative area to prepare for surgery. As a safety measure, you will be asked to confirm your name and age multiple times. Once in same-day surgery, you will be provided a hospital gown, and your vitals on arrival will be taken. At this point, you will be provided with a surgery passport card. This card is a checklist and will provide you with insight regarding where you are in the surgery process. It is important to note that delays are possible. We will keep you updated every 30 minutes before your procedure. The anesthesiologist will visit you in same-day surgery and discuss the types of anesthesia which will be used during your surgery. If your surgeon has ordered a nerve block, you will receive the nerve block at this time. Your surgeon will also visit you in the same-day surgery. They will ask you to identify, usually with a marker, the site of your surgery. This too is a safety measure to ensure everyone is on the same page. This will be your last opportunity to ask the surgeon any lingering questions before your surgery. You will also be provided a medication to help you relax. The operating room. When it's time for your surgery, you will be moved to the operating room, or OR. The operating room may feel a bit cold. Please let us know if you are uncomfortable. We will be glad to give you a warm blanket. You will be placed on a bed that is designed for surgery. The bed may seem narrow and your arms will typically be outstretched to your sides. During surgery, your surgeon is going to remove the bone and place your new joint. As a part of this process, he or she is going to test the prosthesis by moving the joint in various motions to ensure proper sizing and range of motion has been achieved. This will result in muscle soreness and pain after your surgery because you probably haven't been moving these muscles much due to arthritis and stiffness. Without use, your muscles will atrophy or shrink and get tight. So when the physician is testing your new knee, those muscles are going to get a workout, and you're going to feel it after surgery. This can be a fairly substantial pain, depending on your level of activity prior to surgery. Remember those exercises? But your pain can be controlled through icing, elevation, and pain medication, all of which we highly encourage.
After surgery. Now that we've covered the essentials for your surgery day, let's look at what to expect following your procedure.
After surgery, you will be moved to the Post-Anesthesia Care Unit, or PACU. Here we will monitor your vitals, help you manage your pain, and answer any questions. Other symptoms you may experience include dry mouth, nausea, itching, or chills. It's important that you notify your nurse if you have any of these symptoms. It is important for patients to understand that they are considered a fall risk. Your leg is going to be weak, and if you had a nerve block, it may also be numb. This, coupled with blood loss during surgery, anesthesia, and pain medication can leave you feeling a bit dizzy or lightheaded. You could even pass out. For all of these reasons, it is in your best interest to call for assistance when you need to get in or out of bed or up and down from a chair. This goes for both patients who are discharged home as well as those who get admitted. You do not want to have to go back to surgery because you've fallen and damaged your new joint. Ask for help. Prior to discharge, you will be seen by physical therapy and shown how to navigate using a walker, up and down steps, and in or out of the car. You will not be discharged until we are confident that you are able to navigate stairs effectively. Discharge. Patients who have surgery at the hospital location are offered the use of our discharge medication delivery service. This service is available for patients who spend the night, as well as patients who go home the same day. This service allows us to fill any medication prescriptions your physician has ordered for you at discharge, your pain medication, anticoagulants, etc. This way, you will have these when you leave and will not need to make a stop at the pharmacy on the way home. If you are interested in participating, just let us know when you check in, and you will then be enrolled in the program. We'll prepare the medications and deliver them to you prior to discharge and collect your co-payment. This is a one-time thing. You are not required to use our pharmacy afterwards. Upon discharge, you will be wheeled to your vehicle. If possible, it is preferred that you leave in a mid-sized vehicle, simply because they are easier to get in and out of. If you have a low vehicle, some pillows on the seat might help. If you're particularly concerned regarding your ride home or anything around your house, please bring this up to physical therapy. This is their area of expertise, and they will be happy to provide insights.